Hi, my name is Todd Loehrke and I'm a physical therapist with orthopedic and spine therapy. I'm here today to discuss workplace ergonomics and how we can use that to treat and prevent neck and low back pain. For my example today, I'm going to show you Deanna, and this is her workstation. And the first thing I'd like to do is just take a look at it and see what could be done better. Where is her musculoskeletal system working much too hard that it would be causing pain after a long day of sitting in this position? So the first thing I notice is Deanna's leaning forward both to see the monitor and to reach her keyboard and mouse. And that happens throughout the day as we work on different things in front of us. The keyboard and the mouse tend to migrate further and further away, and we have to reach a little bit farther each time. So what I'm going to do to correct that, very simple changes, is I'm going to have Deanna bring the keyboard directly in front of her and the mouse within easy reach. That way, she's not leaning forward, putting excessive stress on her neck and thoracic spine. In the case of the monitor, I'd actually like the monitor closer to her, so it's directly in front of her. It's adjusted so it's easy to read without much eye strain or too much reflection from the lights, and within easy reach of her eyes and her hands throughout the day. Now, if she does need to work on something in front of her, I'd suggest she move the keyboard to the side, work on what she needs to work on, and then bring the keyboard back as she needs it. With the mouse too far forward, we see a lot of neck pain problems, numbness and tingling throughout the arm, or shoulder pain as we reach forward and drop the shoulder. Now, the next thing I want to look at is how is the height of her workstation for her height and her body type. In this case, the workstation is a little bit low. Go ahead and hold your hand in front of you with your thumb up. That is where I would expect the center of her monitor to be. And the keyboard itself, you can lower your arm now, should be at a comfortable 90-degree angle at the elbows with the shoulders up and back in a good posture and the chin pulled in. What happens throughout the day when we're leaning forward, these neck muscles are working constantly to hold up the weight of our head. As we bring the head back and balance it over the thoracic spine and shoulders, there's less energy required and the muscles can relax and we can focus on the work that we need to do without that excessive neck strain. Now, throughout the day, since we're thinking about what we're working on and not the position we're working in, we tend to take the shape of our environment. So it's much easier to build these changes into the environment, which is what we call ergonomics, rather than use a sheer force of will to keep ourselves in a good posture all day long. So first, for the worker who has neck pain, what I recommend here is a thoracic spine support, which we're going to place at her thoracic spine just below the level of the bottom of her shoulder blades. What this does, it allows her shoulders to come up and back and her head to be centered over her shoulders and thoracic spine, thereby lessening that stress on those cervical muscles. In this way, as she's thinking about what she's working on, the chair is doing the work for her by keeping her in a good position. Now, if her complaint was low back pain, we treat that a different way, and we use a lumbar support instead. For that one, we're going to place it in the small of the back. This one has a nice strap to keep it in place on the chair. And we're looking to maintain the natural curvature of the low back. And that's very important because that takes the stress off the discs of the low back and it allows the back to heal, especially after a back injury or a strain. It also helps position her shoulders and head in a good position, although maybe not as good as the thoracic spine roll. It is much better at her low back. Now, if we're going to look at Deanna's lower extremities, we'll pull her out here. And what I'd like to see is her feet resting comfortably on the ground, about a 90-degree angle here, and a seat pan that isn't so long that it prevents her from being able to scoot back to the backrest of the chair. So for Deanna, optimally what I'd like to do is lower her down to the point where she looks comfortable in the positions of her legs and her hips. I'd like her to scoot back in the chair just a little bit so we take full advantage of that lumbar spine support, and that still leaves enough room here at her legs for her to be comfortable. Now, since we lowered the chair, we're also going to have to make sure that the desk and the computer are at the proper height for her as well. Through making these changes, we can help prevent the onset of neck pain through repetitive stress injuries. We can also help treat neck pain, low back pain, and other issues that develop throughout the day or are irritated through these poor ergonomic positions. As always, if you have further questions about ergonomics or you want to go through a full treatment program to address your pain, contact your orthopedic and spine therapy physical therapist and arrange an initial evaluation.